Stop for a moment and look around your home. That old storage room. The garage you rarely open. The garden shed that has been closed for months. The boxes sitting untouched in the corner. For most people, these places seem harmless. But for adults over 60, there is one hidden risk that deserves your attention, especially if rodents have ever been nearby. It is called hantavirus. The danger is not because it is everywhere. Infections are uncommon. The concern is that when someone does become infected, the illness can become serious very quickly. Today I will explain what hantavirus is, how people are exposed, the warning signs you should never ignore, and the simple steps you can take to protect yourself and your family. Because when it comes to your health after 60, prevention is often your strongest protection. Welcome back. As we get older, protecting our health becomes less about fear and more about awareness. Our bodies naturally change with age. Recovery can sometimes take longer, and certain infections may affect older adults more seriously than younger people. That is why understanding potential risks before they become problems is so important. Hantavirus is one of those risks. It is a virus carried mainly by certain rodents, especially deer mice in parts of North America. The rodent usually does not appear sick. It can carry the virus and leave it behind through urine, droppings, or nesting materials. The virus does not spread by simply seeing a mouse. The main concern happens when contaminated materials are disturbed and tiny particles become airborne. This can happen during activities such as cleaning an old cabin, moving stored boxes, entering an unused shed, or disturbing areas where rodents have been living. Think of your lungs as a delicate filtering system. Every day you breathe thousands of liters of air. Your body has natural defenses designed to trap and remove unwanted particles. But if certain viruses enter deep into the lungs, they can trigger a serious immune response. Hantavirus can affect the lungs and blood vessels, causing inflammation and making it harder for the body to get enough oxygen. Early symptoms can be easy to mistake for common illnesses. Many people first experience fever, extreme tiredness, muscle aches, headache, and feeling generally unwell. At this stage, many people may think it is just the flu. But the important difference is what happens next. In some cases, breathing problems can develop rapidly. Shortness of breath, chest discomfort, dizziness, or feeling like you cannot get enough air should always be taken seriously, especially if there has been possible exposure to rodents. One of the biggest misunderstandings about hantavirus is that people think they need direct contact with a rodent. That is not always the case. The risk often comes from disturbing contaminated areas. And imagine opening an old garage after several months. You start moving boxes. You sweep the floor. You shake out old blankets. Dust rises into the air. If rodents were present, those actions can potentially increase exposure. That is why cleaning methods matter. A simple mistake like sweeping dry droppings with a broom can create unnecessary risk. The goal is not to panic. The goal is to clean smarter. Adults over 60 should be especially aware because the aging body may respond differently to infections. The immune system changes over time, and the lungs may have less reserve compared with younger years. This does not mean every older adult is at high risk. It means preparation matters. The best protection is not fear. It is knowing what situations deserve caution and taking simple preventive steps. How do you know when symptoms may require urgent medical attention? The early signs of hantavirus can look similar to many common illnesses. A person may experience fever, strong fatigue, muscle pain, headache, chills, and nausea. These symptoms alone do not immediately reveal the cause. The situation becomes more concerning when breathing problems appear. Pay close attention to symptoms such as shortness of breath that gets worse, feeling unable to breathe normally, tightness or pressure in the chest, extreme weakness or dizziness, or a rapid decline after several days of feeling sick. If these symptoms appear, especially after spending time in an area where rodents may have been present, do not ignore them. Tell your healthcare provider about the possible exposure. A simple sentence like, "I recently cleaned an area where rodents may have been present," can provide important information that helps doctors make better decisions. Now the 5 practical steps that can reduce your risk and help you stay protected. Number 5, check the places you rarely visit. Many people only think about cleaning the areas they use every day. But the places we ignore for months can sometimes become the places where problems develop. This week, take a careful look at garages, basements, attics, storage rooms, garden sheds, old vehicles, and outdoor buildings. You are not looking for a reason to panic. You are simply checking for signs such as small dark droppings, chewed materials, nesting areas, unusual odors, or signs that rodents have been active. If you find signs of rodents, do not immediately start cleaning. The first step is to protect yourself. Script 15. Number 4. Use the right protection before cleaning. One of the biggest mistakes people make is treating rodent-contaminated areas like normal dust. They walk in, grab a broom, and start sweeping. That is exactly when unnecessary exposure can happen. If you need to clean an area where rodents may have been present, wear a well-fitting respirator such as an N95 mask, disposable gloves, and clothing that can be washed afterward. The purpose is simple. Create a barrier between you and potentially contaminated materials. Remember, a few minutes of preparation can prevent a serious health risk. Number 3. Never sweep rodent droppings dry. This is one of the most important cleaning rules. Avoid dry sweeping, shaking dusty materials, using a leaf blower, or creating clouds of dust. Instead, open doors and windows if possible and allow fresh air to circulate. Wear protective equipment. Moisten contaminated areas with disinfectant before removing materials. The goal is to prevent particles from becoming airborne. Clean slowly. Do not rush. Your health is more important than finishing the job 5 minutes faster. Script 17. Number 2. Know when to ask for medical help. Many people wait too long when they feel sick. Sometimes that is reasonable, but certain combinations of symptoms should not be ignored. If you have fever, strong body aches, increasing tiredness, and difficulty breathing, and you recently cleaned an area with possible rodent activity, contact a medical professional. Do not forget to mention the exposure. Doctors can only consider possibilities when they have the right information. Number 1. Talk with your doctor about your personal risk. The most powerful protection is not a product, it is preparation. If you are over 60 and you frequently spend time in places where rodents may appear, discuss your situation with your healthcare provider. Especially if you own rural property, clean old buildings, spend time in cabins, work around storage areas, or help maintain farms or outdoor spaces. Your doctor understands your personal health history and can give advice that fits your situation. Let me leave you with this. Hantavirus is not something that should make you afraid of your home, your garden, or the outdoors. The goal is awareness. Most people will never encounter this infection. But smart people prepare for risks before they become problems. A few simple habits can make a big difference. Check hidden spaces, protect yourself when cleaning, avoid creating dust, pay attention to unusual symptoms, and never hesitate to tell your doctor about possible exposure. If you know someone who spends time cleaning garages, barns, sheds, or old storage areas, share this video with them. Sometimes the most valuable information is the information we share with the people we care about. Stay safe, stay informed, and take care of yourself.